Welcome back. I'm so excited on this segment of Beyond the Fit to actually have a urologist and a specialist that's bringing over 10 years of experience. So he is about to really get you guys straight really quick on our sexual health topic that we talked about in our last episode. So join me in welcoming Dr. Paul Gittens, who is a leading sexual medicine specialist and urologist. He actually works in Philadelphia and New York City at the Centers for Sexual Medicine. Dr. Gittens has been profiled on CNN, Men's Health magazine, and tons of other articles and notarized in Philadelphia. So he is very awesome. And thank you for joining us, Dr. Gittens.
Thanks for having me on your show. I really appreciate it. And, I've seen a lot of your work, and you do an awesome job in really getting the message out to all your listeners.
Well, thank you. Thank you. So first of all, let me just tell you guys, in case you haven't listened to the episode before this one, we did an episode about sexual health, and I talked about topics for men and women. And I told you guys that I was going to bring in a specialist, a guru that was going to get you guys straight about the men's sexual health topics. So don't send me any more messages complaining to me about, I don't know about erectile dysfunction and men's topics. So I know that a lot of men are scared to go to their primary care doctors. I know a lot of men are scared to go to the urologist. I know that there's some kind of stigma, and I don't know exactly why men are kind of more hesitant on seeking medical treatment than women. So that's why I really have a passion on these types of topics, because I definitely want men to understand that if you have something that you're dealing with, you're not on by yourself. Like, there's a ton of other men that are going through these same issues. So what I want to do is basically just touch a couple of key points today with common issues that aging men have, things that they complain about, things that they may not even know are an issue until they hear it. And then they're like, oh, so that's not a normal thing. And I know that there's a lot of questions, there's a lot of concerns about sexual health, because I know in society, sexual performance is very important to most men. So that's why I know that there's kind of like that hesitance on seeking out information and things like that, because they don't want to deal with issues or feel like they're even having issues. So first issue we're going to talk about today is going to be erectile dysfunction. And I think that that is such a major topic, because it's very common. I talked about statistics in my last show, but I know Dr. Gittens is going to go into more detail since he is the professional urologist. So he has a lot of information. But if you could give us some of your knowledge, Dr. Gittens, about like the complaints that men have when they come in, how are they identifying anything that has to do with erectile dysfunction, and what are like your recommendations, and how do you treat these things whenever they do come in?
Yeah, it's so many things to talk about and so little time, but I'm going to try to wrap things up and try to make it as concise as possible. So at least in my office here in Philadelphia and in New York, we try not to say erectile dysfunction, right? We try to say erectile difficulties.
Oh, got it. Sorry.
Why is because when we think about something as dysfunction, we think it just doesn't work, right? And the more I do this, the more patients I see, the more I realize that it's this continuum of symptoms. So some guys can just have some problems with starting, right? Or they can have some problems with maintaining their erection. Their erection can go from 2 to 8, right? And so there's this continuum of erectile difficulties that men face, and it's different for everyone. And you had mentioned that guys don't like to talk about any kind of erectile difficulties or anything that's going on with their body, and I think that's part of that is that we just guys are in general are introduced to physicians a little bit later than women. And so for women, as they go through puberty, they start getting introduced into the medical system, where most guys, they have a high school physical and they don't see their doctor until their first prostate exam, which is, around 40 or 50. So there is that familiarity with the medical system. But also, guys, we just, we really care about our sexual function. It's important to us. It's an extension of our arm, our brain, and so when things don't work out the way we want it to, we really take it to heart. And when you look at statistics on guys that have erectile difficulties, we have higher rates of depression. There's, more days off from work. There's more marital distress. There's so many issues. I have guys in my office that have erectile difficulties, and, instead of going upstairs to bed, they'll watch the game until 12, 1 o'clock in the morning, so they don't have to deal with it. So it's a lot of psychology that goes into the erectile difficulties. So in terms of how common it is, it's really common, and it's more common than we think. In this country, we talk about everything. We talk about, on billboards, you see sex everywhere, right? But we just don't talk about some of the difficulties that we have as we get older. And it's so important that we can talk about this in this open forum. And once again, I'm so glad that you're doing this. So in terms of how common it is, if there's 100 40-year-olds in a room, and I say, how many of you guys have erectile difficulties, right? 40% of them will raise their hand, right? If there's 100 60-year-olds in a room, and I say, how many of you guys have erectile difficulties? It's about 60% of them. So it's really, really common. And I think we all need to recognize that and recognize the signs. So one of the things that we know about erectile difficulties is that it could be a reflection of what's going on in the body, right? So we know that guys that have erectile difficulties, they do have higher rates of high blood pressure, right? They have higher rates of diabetes. They have higher rates of cardiovascular disease. They may be on some medications that can promote some guys with difficulties. So those are all things that we look at when you come into the office. I think it's always important if there's any physicians that are out there and listening to this conversation, is you keep it open, right? You keep it to the point where it's not stressful for the person to talk about it. And also you may want to bring it up to your patients. So I think it's really important. And for guys out there, it's so important just to tell people that there is a problem. That's the biggest thing. And so when we get into erectile difficulties, I mean, I don't know if you want me to go into the treatments or what have you, but as I mentioned, it ranges from a number of different problems that guys can have in the bedroom, and it can lead to a lot of social issues that guys might experience afterwards.
I would love to hear your recommendations or your treatment, because I think that that's also a key factor whenever people are like, okay, I have this problem, but I'm scared of how it gets treated. Like, are you going to cut me off? Are you going to what are you going to do? Hold up. So if you could maybe go into just a couple of things that are just your common treatments, that I think maybe that would help with that dialogue that they have with their urologist as well.
Of course. So you got to understand, I'm a sexual medicine specialist, so my workup is going to be a little more thorough than most other urologists or family practitioners, but I'll kind of go through with what I do. So a guy comes in, and it's so important for me to talk to them. I have to figure out exactly what's going on with them. When are they having the erectile problems? Is it starting? Is it keeping? Is it afterwards? Is it the fact that they can't have sex again? So all those things, after they ejaculate, all those things are so important to me. And then what I always like to do is I like to get some blood work, and just to make sure that there's no other health conditions that are going on with them. For me, I'm a sexual medicine specialist, but I'm also a men's health specialist. I want to make sure that the body is doing what it's supposed to do. So we'll get some blood work. We'll look at cholesterol. We'll look at thyroid. We'll look at testosterone, which is something that's really big in a lot of guys, and they want to know what their testosterone levels are. We'll look at growth hormone levels. We'll look at a number of things that affect the erection. From there, I like to personally do an ultrasound of the penis. I want to know exactly what's going on with the vasculature. So if you think of erectile dysfunction, and you kind of use the analogy as kind of like somebody that has chest pain, right? So somebody's got chest pain, they go to the hospital, they'll get an EKG, and then they'll go to their cardiologist and they'll get an echocardiogram, which is an ultrasound of the heart, right? And with that ultrasound of the heart, they're able to see the function of the heart. So for me as a sexual medicine specialist, I want to see the function of the penis. What's going on? Is your issue the fact that you're not able to get enough blood flow to the penis, right? Is your issue that the blood flow is going in and it's leaking out? Is your issue that you have all this scarring in the penis and that's what's causing it? So all of these things are really important to me in order to try to figure out which direction of treatment I want to go in. And then from there, I sit down, I talk to the guys. And in my practice, we have restorative therapies, which we actually help to restore the penile function. And then we have these things that are treatments. So treatments are something you take when you want to have intercourse. And there's differences for both. And so something like a treatment would be something like Viagra or Cialis. So that's something that is a treatment. Another treatment is something like some guys will do injections into their penis to help them get an erection. In my office, we focus a lot on the restorative therapies. So before we start anything, we try to talk about lifestyle, right? We start talking about exercise and diet and what you should be eating just to help with your sexual function, because that's so important. We talk about maybe losing weight if they're obese. We talk about if they're diabetic, how can we control your sugars so this thing doesn't progress to the point where it's to the point where you're not having any erection. So then you're truly dysfunctional, right? So all these things we talk about. And then for restorative therapies, I've had the pleasure of working with low intensity shockwave therapy, which is something called core wave therapy, which we've developed in the office. I'm the founder, as well as I train only urologists all across the country how to use this technique. And so with this, what it does is it helps to increase the blood vessels to the penis. And then from there, these guys are able to get spontaneous erections again, or say they were on something like Viagra or Cialis and it wasn't working, we can get them back on that medication and put them on programs where we can rehab their penis, just like we're rehabbing their hip if they just had surgery. So these are all important. We do use like platelet-rich plasma. We use a number of things that can help to restore their functioning. Like the core wave therapy, like PRP, some of the other things, they're not FDA approved. But we still use them off-label, and they work fantastically. So that's something else that we can do, especially for guys that want more of a natural erection and they don't want to rely on some of the treatments. So we have guys flying from all over the country to come to our office just to kind of experience some of these new restorative therapies that we have. So, in terms of erection issues, it really, just to sum it up, it really depends on the severity that person has. It depends on their medical problems. The key is always to try to change their lifestyle if we need to, put them on either medications, if they're on medications like for the heart or for psychiatric medications, to try to talk to their doctor and try to get them on meds that are more penile friendly, right? So diet, exercise, changing any kind of things that we may see, and then helping to restore their erections and their penis to the point where they have more confidence and then they can enjoy a nice sexual life.
And I just wanted to ask you, as you're talking about the treatments and the recommendations, I did mention that in my previous episode about the weight gain and how exercise actually helps, and how anything, whenever you're talking about penile function and erections, anything that has to do with narrowing blood vessels like diabetes or high blood pressure, how that affects it. But I wanted to just ask you, I know that, because I kind of said this as a joke in my last show, but now that I have you as a specialist, when you walk up to the register, you're like, give me a lottery ticket and one of those things in the green pack with the spider on it or whatever. Like, there's so many of these over-counter supplements that you can get next to the 5-hour energies or whatever. What is your professional opinion about that? Because I know a lot of men kind of like self-treat at home, or they use these supplements. Like, do you have any experience or knowledge or an opinion about those over-the-counter supplements in comparison to that? Mm-hmm.
Yeah, I do. But just before I answer that, I mean, I think that what you talked about before about weight loss and, really trying to optimize that part of their health is so important, right? I mean, just with weight loss alone, we see testosterone goes up exponentially. So that's key, because testosterone does have a lot to do with sexual function. We see that self-esteem goes up exponentially, right? So if you look good, you're going to feel good. You're going to feel sexy for your partner, whoever that partner is, right? And so that's going to help you in the bedroom, and that might even help your partner get a little, be a little adventurous as well. So those are things that are really, really important that we want to make sure we emphasize is, getting that diabetes under control, losing that weight, and just like feeling like just the best you can be, just optimizing. And I do a lot of optimization here. It's just optimizing what we have and really just making you try to live your best, right? And sexually. So in terms of, over-the-counter meds, it's to me, I have a lot of guys that come in and they'll try something at the gas station, and then they'll say, "Hey doc, like I don't want to try something like Viagra or Cialis. I just want to, I want to try something natural." And to be honest, a lot of most of the medication at the gas station, actually, when you do chemical analysis, they have a little bit of Viagra and Cialis in it anyway, right? So a lot of guys use all these, these black this and black rhino and all these other type of things, but it already has those chemicals in it. So they're already doing it, right? So they're already taking some of these things like Viagra or Cialis. I would just warn guys about what they're taking, because it should really be under a doctor's supervision, I think, because they might be on some other medications that can have a negative effect of what they're taking in the drugstore. The other thing is when they do chemical analyses of these medications at drugstores, they realize that, and guys will tell you, they're like, they took it once, it worked. They took it again, it didn't work. They took it again, it kind of worked somewhat halfway, right? So when you look at these pills and you do a chemical analysis, oftentimes it's not the same amount in each pill. So we might say 20 milligrams, but you look at the other one and the other one's 5, right? If you do a chemical analysis on another one, it might be 2. The next one might be 100. So with these medications that guys get over the counter, there's no regulation. There's nobody doing any validated testing in terms of each individual lot. So guys just have to be careful. But, I understand why they're doing it, right? Because it's so accessible, right? They don't have to go to a doctor. They don't have to tell people that they're having erectile difficulties. So, I'm human and I understand why they're doing it. I just think it'll be beneficial if they can find somebody that they trust, that they can talk to, and really figure this thing out, so they're not playing a guessing game. So I think that's the most important thing. But I feel it. I feel them. I'm a guy.
I'm like, okay, because it's literally 5-hour energy, buy a lottery ticket, and get a.
It's right there. Why not? Why not? Get it? Trust me, I get it. But the thing is that it's a lot more things out there that are safe, that are effective. That's more effective. Because the issue is, it's kind of like it's like you're pulling a slot machine. It's sometimes it works, sometimes it doesn't work. But when it doesn't work, what happens is you get down, right? And you feel like the next time you may not succeed. So that kind of feeds into furthering the erectile dysfunction or difficulties that you might be having. So it's really important that, if you can get on something and you can have sex consistently, that's going to help you in the end, right? Instead of playing around with all this other stuff. But, I feel like guys have to go through that process, no matter how much I say that it's probably not the best thing to do. You got to go through that process. You got to fail a little bit until you muster up enough courage to say, hey, listen, I got a problem. I need somebody to help me fix it.
Is there a risk of like I know like certain things, there's a risk of like overdose, or there's a risk of long-term damage. Is there a risk for the men that are getting those supplements? I know you said they aren't regulated, but do you know, in your, expert opinion, is there like something that could long-term, like, is there like a, caution?
I think there's caution, and the reason why is because you're not really sure what's in it, for one. Also, there could be some interactions with the medications that you're taking. That's another thing that you may not even know of. And then guys and when guys start taking these, a lot of times they're a little more desperate. And so instead of taking the recommended amount on the bottle, they're going to take 2, 3, 4, or 5 times the amount. And so that's where we get into a little trouble. And before I kind of pointed out some medications, and I don't want to say those medications are bad that you buy over the counter. Those are just examples.
Right.
But I just think in general, guys just have to be a little more careful in terms of what they're doing. But the best things to increase your testosterone and your erectile function, and I don't want to harp on this again, is really exercise. I mean, if you look at ways to increase your testosterone, if you lift, right, you increase your growth hormone, you're going to increase your testosterone, you get better sleep, you reduce your stress. Those are all really good ways to increase your natural testosterone where you don't even need to take these supplements half the time.
No, and I love that, because that's actually in my sexual health episode before this, I did, as a fitness professional, I was like, these are the pros of exercise. So I think that's great that you're reiterating it. So see, I was right. She was right. Specialist co-signed on it. And I love that you actually started talking about testosterone, because that was kind of the next question that I wanted to ask. That was one of the common questions and issues that I know when we were talking about men's sexual health. And can you explain, like, I kind of touched on testosterone, and I just generally explained, because I didn't want to go into detail as just like a nurse, because I don't know the specifics, but can you explain what is high and low, and what is a healthy range of testosterone? Because we keep talking about it, and then there's always these like, oh, bad testosterone causes prostate cancer, but high causes prostate, but low is this, or like, so can you explain like what a healthy testosterone level is, and what are some of the high side effects and low side effects?
Yeah. So first of all, testosterone is a hormone, right? And it's made in the testicles for men, right? And so what happens is it floats throughout the system, and then on the organ, so in the brain, in the muscle, in the bone, in the penis, in the prostate, there's these little gloves, right, that pick up this testosterone from the bloodstream, and then it brings it into the cell, and then it starts to read, right? It's like a book, and it reads, and it tells whatever that organ is what to do, right? So in the brain, sometimes it can help with libido. In the bone, it can help with strengthening the bone along with estrogen. In the penis, it can help with some erectile difficulties, right? And so, we've gotten into the point where, like, every time I turn on the radio or I'm on the internet, and it's like testosterone is going to do everything for you. So testosterone is going to allow you to like be the man you want to be, right? To have sex for 20 hours, it's all testosterone, right? But we know that that's not really the way it works, right? And so we know that for guys, they have different levels of testosterone that are going to optimize them, right? And so when guys ask me this question all the time, like, what's the best testosterone? What should my total testosterone be? And the answer is it's different for everyone. If you really want to know the answer, I have guys that come in my office and they have what I think is a fairly low testosterone, but they're having sex, their energy is fantastic, their muscle mass is great. So it's more to it than just the level, right? But we do know there are some parameters where we'll say that you have low testosterone. That number is usually around 300. That's kind of the record. That's, by the Endocrine Society and in the Urological Society, it's anything lower than 300. We know that there is this gray zone too. So some guys that are above that number maybe still don't feel so good. And it probably boils down to what was your testosterone at your highest point, and then what is your testosterone now, and probably that level in between, that drop off. So say I was 1,600, say I was 3,000. I wasn't, but when I was 18, that's really high, by the way. And now say I was 2,000, and now I'm 300, right? So think about that drop as compared to when I was 18, if I was 1,200, and now I'm 400, right? So that drop is a lot less. So that the guy that probably had the bigger drop is probably going to have more symptoms. Does that make sense?
Mm-hmm.
So it's really different for everyone. We try to of the normal range. And sometimes we want to optimize you, but we still have to be careful. In terms of testosterone, we want to make sure that you got some symptoms before we treat you with testosterone. So if you don't have any symptoms of low testosterone, then there's no reason to treat you, right? So if you're not complaining of problems with erectile difficulties, if you're not having fatigue, if you're not having decrease in muscle mass, if you just have a low level of testosterone, whatever your testosterone level is, all right. So it's a more complicated conversation, but in general, we want you to be at least above 300. But we know that there's a large gray zone there.
Okay. Good. Thank you for that clarification, because I think, like you said, there's so many supplements. I mean, even me, like just going into a nutrition shop and I'm looking for just some regular protein or whatever. And there's like a whole section of like all of these things, you know, for testosterone boost and stuff like that. So I do think that there's a lot of emphasis on it, on that, and they don't even know what it means, or they don't even know what their levels are. So I think that was a great explanation. Like, first of all, this is the difference. This is what it is. And adding testosterone products is not going to always give you some type of magic power to heal everything in your life.
Yeah, not at all. And for women as well. I mean, we use testosterone off-label for women for sexual desire, and so their testosterone goes down as well, and so we'll treat them for their sexual function for that as well.
Okay, great information. I'm learning a lot today. So whenever we're talking about sexual health and we're talking about men, we can't not talk about prostate, because I think that there is like a miseducation or maybe an obliviousness to the prostate gland compared to testosterone. And people always think, you know, oh, okay, well, if I'm having issues with BPH, or if I'm having issues thinking I'm having prostate problems, I need to take testosterone to fix my prostate. So can you give us, as a specialist and a professional in this department, can you give us a thorough kind of breakdown of the difference between the prostate gland and testosterone, and what issues are with? And I know I don't want to go into the whole thing about prostate, but if you could kind of give a differentiation to kind of say how these are two totally different tests. This is a marker for the PSA compared to, testosterone, whatever. Like, can you give us how you?
Yeah, so the prostate. So what's the prostate? The prostate's a gland, and it so as urine flows from the bladder and it goes to the urethra, which is the area, that tube that's in the penis, it's got to go through the prostate. As well as when guys ejaculate, right, the fluid from the ejaculate, so the sperm, they form the semen. And the reason why it's formed semen is because there's a lot of fluid in the prostate and these things called seminal vesicles, which combine with the sperm and they make semen, right? So the prostate is an important organ for reproduction. I mean, that's really what it's used for. It's helping the sperm kind of get fluid to turn to semen. But there's some issues with the prostate that can happen over time. So the biggest two issues are BPH, like you mentioned, which is an enlarged prostate, and then you have prostate cancer. So those are the two biggest things. The prostate is it's an organ that is it's stimulated by testosterone up to a certain level, right? Up to a certain level. So as guys get older, the prostate can get larger, and as it gets larger, what happens? It starts to kind of squeeze the urethra. So when you're urinating, you can have some like a weak stream. You can have some issues with urination, where you're going to go to the bathroom more frequently. You might be standing at the urinal. Guys start waking up in the middle of the night to go to the bathroom. So that's called BPH. All right. There's another problem, as I mentioned before, with the prostate, which is something called prostate cancer. So prostate cancer is when there is abnormal cells which grow rapidly, which is cancer, that occur in the prostate. Right. So those are the two major things that happen to the prostate. Right. And so, as I mentioned, the prostate is somewhat driven by testosterone, but only to a certain point. And so testosterone in general doesn't usually affect either one directly, if that makes any sense. I mean, we can get to the but we do know that up to a certain testosterone level will have effect, but after it gets to that certain level, like in around the 200 or 300s, it doesn't really affect the prostate as much.
Okay, I think that that's an important kind of topic that men maybe don't understand, like you said, especially if they're only going to primary care doctor later in life, or they only go to the doctor when they have something. And then I think even the younger people, they hear all of these words like prostate and testosterone, and they think they're interchangeable. So I think that that's important for them to understand that those are two different things. And so
I'm sorry.
No, go. What were you going to say?
They're definitely two different things, but when you talk about prostate cancer, it's something that guys should really, investigate, right? So as guys get older, they do have more likelihood of getting prostate cancer, especially if you're African American. You're going to have a much, much higher rate of getting prostate cancer. So, the recommendations are to undergo a PSA. You mentioned that before, which is prostate-specific antigen. So you make sure you get a PSA and an erectile exam. Those are two ways to help to diagnose prostate cancer. Usually for BPH, guys will say, listen, doc, my stream is a lot slower, or it's taking me a long time to go to the bathroom. And then from there, your urologist or your primary care doctor will probably do a rectal exam just to make sure you have an enlarged prostate, and they may put you on a medication that can really help solve that.
And I'm glad that you brought that up too, because I actually went to a comedy show recently, and the comedian was like, the joke was how as men age, how now they're standing over the toilet, and he had his hand on the wall, and he was saying like, welcome to like being over 40, which is kind of like our ebony, that's our demographic too, is like this middle-aged thing or whatever. So I'm glad that you brought that up, because if you are having those issues, like Dr. Gittens said, it's a simple test, and it's an oral medication that you can take, and I think that people are so worried about the treatment that they don't want to go get the test because they're worried about the treatment. So I'm glad you spoke about that as well.
Very, very simple to treat that. Very
simple. I know. And me, I also am a nursing professor. So whenever I teach like that whole section and we talk about like the TERP, and so I think men are thinking about like, oh my God, they're going to stick the rod. And it's like, hey, there's steps before we get to that point. Like,
exactly. Medications that relax the prostate. There's medications that help to shrink the prostate. There's so many things that you can do before surgery.
Okay, good.
Surgery has gotten better. I mean, there's things you can do in the office. There's just small procedures where you can kind of lift the prostate just to help with the flow. So really simple things, and it's not that bad where you shouldn't ask for help. Right.
Okay. All right. So thank you guys for listening. And I know Dr. Gittens, we could go on and on and on for a long time. And I know you're very busy fixing everyone's sexual health issues. So we don't want to keep you, but do you have any final advice for like just any person that's listening to this show that maybe is having some type of sexual difficulties, or like, do you just have like some advice that you just say, hey, listen, this is the key thing that I want to give you guys to take away from this show today?
Yeah, I mean, I would say that if you have a problem, really, you got to face it head on, and, the longer you wait, it's the harder it is to treat. It's always easier to treat somebody early on. I think you got to pay attention to your body, and you have to try to do as much as you can to keep your health in the best shape it can be. And that's like eating properly if possible, dieting, if, healthy lifestyle, exercising, all those things are so important. But if you want to live to, you want to have a good, and if you want to have a great sex life, those are the things you got to do. If you keep your heart right, if you keep your diabetes under control, if you pay attention to your penis when it's having some difficulties, and you go to a specialist, then, there's no reason why you can't have sex up until you're like 90 years old. I see guys all the time. I saw a guy in my office. He was 85. He's like, Doc, I want to, I want to be able to do what I did last year. I mean, this is a guy that had sex. He was having sex till like his late 70s. So it's a possibility, but if you keep your body right, then, there's no reason why you can't do it.
Right. And I think that's funny because I said that in my the sexual health episode. I'm like, because you deserve to have a great sex life. You deserve to be 100 and still getting it on. Like, just because you age does not mean that everything shuts down. Like, no, you be 100 and still get everything going. So that's great.
It's maintenance. It's just like everything else. There's a little bit of maintenance that's involved, right? If you got a car, your teeth, whatever it is, it's maintenance, and it's sexual maintenance. It's just the same, you know. And then, you know, if any of your listeners, my Instagram is at drgittens. My website is centersforsexualmedicine.com. I know you guys are in. I don't know where most of your listeners are from, but if anyone's in the area, they can always stop by, and I would love to help them.
And that was going to be my next question. I was going to ask, how can they get in touch with you? Do you do virtual visits for anyone? Because, I mean, this is part of Ebony Covering Black America Podcast Network. So it's part of Ebony Magazine. And we're national, worldwide, everywhere. So, I mean, there's listeners that could be anywhere that have access to stream the show. So how can people get in touch with you? And then if they're not in town, like, what are the options that you have? And then can you give them your Instagram and whatever else handle?
You know, medicine, as you know, medicine's strange. It's like, if you're not in the state, you have a license in the state, it's always hard to give advice and treat people. So, you know, for my clients that come from out of town, we'll do before they come in, and then they'll come in, and then we'll treat them once they get here.
Okay, good. And then, so your Instagram is at
Dr. Gittens, I think. I think it's at Dr. Gittens. At Dr. Gittens. But my website is centerssforsexualmedicine.com.
Okay, got it. Okay.
It's at Dr. Gittens. At DRGITTENS.
You guys can see he's very active on his Instagram. No, you have lots of information on your page, though. That's how I came across it. But don't worry, I'll actually have all of his links and everything in the podcast notes. So make sure you actually read the notes for this episode, and all of his contact information will be in there spelled out, so you guys can reach out to him. I'll have the information for his clinic and his website, so you guys can access that as well. So again, thank you so much, Dr. Gittens, for giving us all these gems today. Hopefully, you know, you helped a couple of our listeners and know that they're not alone. And thank you again for your time.
Well, thanks for having me. You are wonderful, and continue doing what you're doing. The message is fantastic.
Thank you. Thank you.